Today I want to talk a little bit about radiation therapy and how this can affect patients having breast reconstruction. In general, radiation therapy makes breast reconstruction more complex. Radiation therapy is an important component in breast cancer therapies. So if you have breast cancer and your medical oncologist or radiation oncologist recommends you get treated with radiation, I'm in support of that, because the whole goal of your breast cancer treatment is to decrease your risk of recurrence, increase your survival, and radiation therapy clearly is beneficial for this. However, it does make some components of breast reconstruction more complex. The way radiation works is it's putting energy into the tissue where the breast cancer had been removed through surgery. And this energy is meant to kill dividing cells, like cancer cells. But it also affects skin cells, it affects blood vessels, and it affects how your tissue will heal. It'll affect how your tissue will look, and it'll especially affect how an implant is going to respond under that tissue. So in general, the standard for patients who are having radiation therapy and have a mastectomy, they typically need some healthy tissue brought to the area to treat the effects of that radiation. And that tissue that's brought to the area is often called a flap or autologous tissue. Sometimes you can get away with still using an implant without using your own tissue, but the chances for this are much lower. There's higher rates of infection, there's higher rates of exposure to the underlying implant, there's higher rates of capsule contracture, there's higher rates of discomfort, and significantly higher rates of cosmetic deformity. So in general, patients that are having radiation therapy, I counsel them, if they're going to have a mastectomy and need radiation therapy, they should plan with needing to use some of their own tissue in reconstruction. And that might be tissue from their abdomen, or from their back, or from some other distant site to help treat the radiation effects and give them as nice a result as possible.